Hello. My name is Matt, and I will be walking you through these procedures. Now let's get started. Before you start the procedure, you want to get the patient and bring them back to the x-ray room you will be using. The tech then gets the patient history. Let's see what happened. Ow! Now that looks like it hurt. And don't forget to get those two patient identifiers. It's very important you get their date of birth and full name. Since our patient is female and between the ages of 12 and 55, she must sign an informed consent document. Always make sure to shield the patient to avoid any unnecessary exposure of radiation. We will be doing a thumb routine, so we will start by assisting the patient to be seated at the end of the x-ray table. And remove that jewelry now. For the first view, we have a PA hand. The SID will be 40 inches with a field of view of 10 by 12 lengthwise. The central ray should enter the third MCP joint of the affected hand, and we'll be using our right marker. Literally, our right marker. Get it? And now we're ready to make our exposure. Next is the lateral thumb. Have the patient slightly flex the fingers to place the thumb in true lateral position. The SID remains at 40 inches, but the field of view is 8 by 10 lengthwise. The central ray enters at the first MCP joint, and then, after you have them positioned, trolley on over and make that exposure. Lastly, we will perform the AP thumb. You will instruct the patient to place the hand with extreme medial rotation. The SID remains at 40 inches with a field of view 8 by 10 lengthwise. The central ray enters the first MCP joint. Once you have finished the thumb routine, you want to make sure all the anatomy is there on all of the images and none of it is clipped. If the images look good, you can then help the patient remove the lead apron and make sure to thank them for their time and cooperation. Lastly, escort the patient to the checkout. Don't forget to return that jewelry now. Before starting the procedure, make sure to acquire an accurate history. Let's see what happened. Oh, now that's going to leave a bruise. Crocs look fine though. And never forget the patient identifiers. You always want to ask the patient's full name and date of birth. We will start by doing an AP projection of the femur. You will help assist the patient in the supine position if needed. Also, make sure the table bucky is lined up. We will be taking two separate images, first the proximal femur and next the distal femur. For proximal femur, make sure to include the hip joint. Also, it helps to feel for the as-is, and that's where you want to place the top of the IR. The SID will be set at 40 inches with a field of view of 14 by 17 lengthwise. The central ray is perpendicular to mid-femur, so make sure they are all lined up. Always remember to shield your patient and put the marker on the correct side. When beginning the distal femur, you can simply adjust the table and table bucky so that the bottom of the IR is 2 inches below the knee joint. The central ray is still going to be perpendicular to mid-femur. Lastly, we'll be doing a lateral proximal and lateral distal femur. Before starting, you want to help the patient into the correct position. We will start with the lateral proximal femur. The top of the IR should be at the level of the as is, and our central ray is perpendicular to mid-femur. Next, we are doing a lateral distal femur. If the patient laid still, you can slightly adjust the table so that 2 inches beyond the knee are included in our image. The central ray is still perpendicular to mid-femur. Because of that great fall our patient had, she wasn't able to roll over because of extreme trauma. Make sure all the images include all the anatomy and nothing is clipped. And if you give it that little head shake, it's probably all there. Make sure to grab your marker once you are finished, and always lower the table to make it much easier on the patient as you help them off the table. Lastly, make sure to thank the patient for their time and cooperation and help escort them out the door.
Then a little voice inside you whispers, don't sell your dreams so soon. Everywhere you look, there's a heart, a hand to hold on to. Everywhere you look, there's a face of somebody who needs you. Everywhere you look, when you're lost out there and you're all alone, life is waiting to carry you home. Everywhere you look, everywhere you look,